Okay, we're good. So if Sassy wants to share her screen for the presentation and then they can get going.
Okay. Hi everyone. Welcome to the Anime Didactic. So this week we watched Your Name. This is one of my favorite anime movies, probably of all time. So hopefully you enjoyed it. I think we have a really good didactic today for it. So it's definitely interesting. I loved it when I was an intern, especially when our last head TA, Ali, did this. So yeah, let's move on to basically the overview of what happened. All right, so a little summary. Your Name follows two characters, Mitsuha and Taki. So Mitsuha lives in a small rural town outside of Tokyo, and Taki is a high school student who lives in Tokyo, works at a restaurant, and aspires to be an architect one day. Um, the two are complete strangers with no connection to each other until one day they wake up and they have realized that they've been switching bodies. They had a general sense before that something was happening. They were having real dreamlike dreams where they were waking up disoriented and confused about where they were. So it was definitely happening before, but then we finally got to see it once I think we saw Taki wake up in Mitsuha's body. Um, Although they seemed to be taken aback by the situation, the two slowly came to adjust to each other's lives, and both come to help and benefit each other's lives, like in the case of getting a date with Taki's boss, or Taki standing up to Mitsuha's bullies, which she hadn't done before as well. Oh, I think we won't. Yeah, thank you. So after the date with Miki, we see that Taki and Mitsuha stop switching bodies. Out of curiosity, Taki begins to search for Mitsuha by going out to look for her. Before starting the long trip, Miki and Tsukasa decide to accompany him on this journey that is based purely on a photo that he drew based off of switching bodies with Mitsuha. Eventually, he comes to learn that Mitsuha's town was destroyed by the comet a couple years back and sees the death toll, which includes Mitsuha's name. Taki ends up returning to the shrine eventually, where the sake was placed by Mitsuha. And once he sips it, the sake, he begins to see visions of Mitsuha's life, starting from birth all the way up to her current life, and he ends up in her body essentially. And he realizes that this is the last chance to save the village and save everybody from that fragmented piece of the comet. All right, so I wanted to do a little animation appreciation because it is like one of the best animated movies that I've ever seen. Just everything from the scene where Mitsuha is eating rice with her parents all the way up until the comet, and then of course one of the last scenes of Mitsuha and Taki kind of reaching out for each other at the top of the mountain where the crater is and just trying to touch each other, I think is just like a great movie. So hopefully you guys appreciated the animation as much as I do. I absolutely love it. But yeah, next slide. So a major theme that we might see here is particularly fate. So we can see that kind of shown with the comet. So the comet is essentially a symbolizes how their fate should have been. It should have been a straight path, and that they should nothing should have ever separated them. Besides that one, and the fragmented piece of the comet is the kind of alternative storyline that you see going on where Mitsuha and Taki both try to correct each other so that they end up meeting each other eventually, as you can see when they walk past each other on the stairs when they're both grown up. Um, Fate also was symbolized by the red string of fate. So in the previous slide, you saw Taki and Mitsuha or Mitsuha throwing out that string that she had tied in her hair. And that essentially in Japanese culture symbolizes kind of like the red string of fate, which means that they're always going to be destined together. So we see that these trials and tribulations that they have of trying to correct this storyline that happened and get each other who get each other who are fated to meet each other um eventually in after correcting and saving Mitsuha's village and everything like that. So that was the major theme. I think next we're going to move on to disorders and perfect.
Hello, so we're going to be talking about which disorders we're seeing in this anime. Does anyone have any guesses on this disorder? You feel free to unmute or share in the chat. Well, we have to talk about the differences between depersonalization versus derealization. And so let's see in the dissociative fugue, DID or drug-induced psychosis, substance abuse, DID. These are some very good guesses, guys. And in order to get to the disorder, we gotta differentiate between depersonalization and derealization. So, depersonalization is an out of body experience. You see, feel, think outside of what your own body experience. And then derealization is when the environment around you doesn't feel real, it feels foggy or like a dream. Depersonalization is kind of often talked about is someone is outside of their body and they're just looking at how they're going through life from an outsider perspective, like they're in a movie theater. So, depersonalization/derealization disorder criteria, we have to have A, the presence of persistent or recurrent experiences of depersonalization, derealization, or both. During the depersonalization or derealization experiences, reality testing remains intact. The symptoms cause clinically significant stress or impairment in social, occupational, or other important areas of functioning. The disturbance is not attributable to the physiological effects of a substance, a drug of abuse, medication, or another medical condition, such as seizures. The disturbance is not better explained by another mental disorder, such as schizophrenia, panic disorder, major depressive disorder, acute stress disorder, post traumatic stress disorder, or another dissociative disorder. So we have Mitsuha eating like she's in a dream state. And the early scenes where Taki and Mitsuha haven't connected, they feel as if their dreams are real and are great examples of derealization. Mitsuha literally calls it one long dream while spending money on sweets. And often the two wake up feeling that like the reality is a dream and it was affecting their social interactions with those around them. But this doesn't explain the diagnosis because we haven't considered other symptoms. Dissociative amnesia, which is an inability to recall important autobiographical information, usually of a traumatic or stressful nature, that is inconsistent with ordinary forgetting. The symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. The disturbance is not attributable to the physiological effects of a substance, alcohol, or other drug of abuse, or medication, or a neurological or other medical condition, which can include partial complex seizures, transient global amnesia, sequelae of a closed head injury, traumatic brain injury, or other neurological condition. The disturbance is not better explained by dissociative identity disorder, post-traumatic stress disorder, acute stress disorder, somatic symptom disorder, or major or mild neurocognitive disorder. Also, side note, dissociative fugue is a psychiatric disorder characterized by amnesia coupled with sudden, unexpected travel away from the individual surrounding and denial of all memory of his or her whereabouts during the period of wandering. So the scenes that show dissociative amnesia are the ones that indicate that they have forgotten what happened in their dissociative states, like when Mitsuha doesn't know that she had a moment of anger the previous day, or when Taki doesn't remember talking with feminine pronouns instead of usual male pronouns. This is further shown through the fact that they journal to each other to remember what has occurred within their dissociation in their days, but this is a big indicator that another disorder is the real disorder. On the left, we have Mitsuha being told she was acting different the day before and being confused. And on the right, we have Taki being confused about how he got Miss Okidera's attention. And then we have dissociative identity disorder, which some of you guys mentioned in the hat, which has a disruption of identity characterized by two or more distinct personality states, which may be described in some cultures as an experience of possession. The disruption in identity involves marked continuity in sense of self and sense of agency, accompanied by related alterations in affect, behavior, consciousness, and memory, perception, cognition, and or other sensory motor functioning. These signs and symptoms may be observed by others or reported by the individual. Recurrent gaps in the recall of everyday events, important personal information, and or traumatic events that are inconsistent with ordinary forgetting. The symptoms that cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. The disturbance is not a normal part of a broadly accepted culture or religious practice, and the symptoms are not attributable to the physiological effects of the substance, blackouts, or chaotic behavior during alcohol intoxication or another medical condition, such as complex partial seizures. And
Yeah. Can you move to the next slide? Awesome. Yeah, so this is an example more in the latter half of the movie, right? But there are plenty of examples in the beginning of those alterations in memory. So in these specific examples, this is where Taki and Mitsuha tell each other their names, but they almost forget right away. But there are plenty of other alterations and cognitions and memory, specifically in the beginning of the movie, right? When they don't really know what's going on. Um, they're like just like the examples that were presented earlier to you, right? The forgetting of the use of feminine pronouns, or Taki's forgetting of the use of feminine pronouns, or their lapses in memory in terms of days and what happened previously. And everyone's like, you were acting really weird. But they can't really understand where those memory lapses came from, which is part of that criterion A for DID. And then DID also definitely makes sense for both of them since they both have that realization, depersonalization. Sorry, I think that means derealization, depersonalization and dissociative amnesia as part of their illness, right? So DID can have an encompassing diagnosis with all of those aspects included, which our characters definitely demonstrate. And our main characteristic is another personality state, as the characters do experience, right? With Taki and Mitsuha, very different personality states. And even our other characters, like Mitsuha's dad and grandma, notice that she has a completely different personality state when Taki takes over. Similar with Taki's manager, who also finds Mitsuha's personality cuter, kind of funnier. I always think of the example with the skirt fix and such in that first example of Mitsuha in Taki's body. So finds it more cute, fun, enough to take him out or her out, I guess, on a date, where she didn't feel all that interested in Taki himself prior to that experience. Another kind of example of these different personality states, these lapses in judgment and such are displayed below, right? So you're like a different person today, where Miki is saying that he is not the same person, and Mitsuha's dad asking who she is, in that one instance. And that also was a bit of a recurring example, right? We heard the the who are you quite frequently, at least I thought throughout the film. So here, before I even ask this, are there any other diagnoses or characters with diagnoses that come to mind for you guys? Um, does anyone have any questions about what we just discussed? You could unmute, put in the chat. I'll keep the chat open. Adeline says Taki especially seems to have delusions. Yeah, right. And can dissociative amnesia be a symptom of dementia? Um, in a way that wouldn't, I don't think, be classified as dissociative amnesia, right? So dementia is a very encompassing understanding of confusion, kind of memory lapses, a lot of like confusion, right? Maybe partaking in events that or getting ready for events that aren't actually happening or date confusion and such. And so kind of similar presentation in a way. But I'm not so sure that dissociative amnesia is always used as the term referenced when discussing that. All right. Well, if there are no other questions, yeah, of course. If there are no other questions, then does anyone have any other ideas about diagnoses? I did see something in the chat that I agree with that I was going to bring up earlier. But before I do that, I'll give you guys a second. I know it takes a hot second to write in the chat. Anybody? I think, was it Adeline who said it originally? Yes, yes, it was. If that gives anyone a hint of what I'm thinking of, at least, please feel free to make your own conclusions. No guesses? Drug-induced psychosis. It's very similar to what I was thinking. Yeah. Awesome. Okay, so I'll kind of play off of that one first, if anyone else wants to keep typing. So towards the end of the movie, right before Taki re-enters Mitsuha's body for the last time, on the day of the comet, he drinks from the sake. Please correct me if I'm saying that wrong. And has that experience where there's a lot of things visually that go on, right? And then he goes into her body one last time. To me, that almost seems like a drug-induced or alcohol, because drinking induced psychosis reference or illusion in a way, because does everyone remember MICA, the acronym that Dr. T used? Right. So methamphetamines, inhalants, cannabis, alcohol, and hallucinogens can induce psychosis. Those are all of the categories of substances that can induce psychosis. So this to me was a kind of alcohol-induced psychosis in a way. So that's just a small theory of mine, though not totally encompassing, right? Are there any other ideas? If not, that's totally fine. All right. Well, if anyone does have any more ideas, definitely type them in the chat and I'll rework. All right. So moving on to the mental status exam. As a review, I'm sure you guys have seen this in your mock CCCP, as well as in the prior anime didactic. We did go through this a little bit, but once again, this is kind of like what the psychiatrist would take note of as the patient presents in an initial consult. So these categories are not directly asked to the patient, like, how do you feel like you behave or appear in everyday life, right? But they're kind of mental notes the psychiatrist makes and combines into one mental status exam to analyze the patient in this initial consult. So for Mitsuha and Taki, does anyone have any guesses as to, I guess we don't have to go down the list. You can type in the chat anything from the aseptic acronym presented here. But does anyone want to try to give a stab at the mental status exam or just unmute and go for it? Any brave interns at 8 a.m.? I know it's quite early. So Adeline says in the chat, also because he may have been hallucinating when he met Mitsuha. Yeah, I'm assuming you mean with they have long gaps in their memory when they act like another person. Adeline, is this in reference to the alcohol-induced psychosis or a prior
Those
disorder?
are those are supposed to be two separate thoughts. So the first one was with the alcohol. The second one was like appearance slash behavior.
Oh, okay. Thank you. Awesome. So they're longest familiar when they act like another person. Yeah, yeah. So appearance and behavior, this would kind of relate to things that they're thinking, right? So more maybe an insight and judgment type of vibe. Appearance and behavior don't necessarily have to be anything they're speaking of. It's more like, does the person come in uh and present themselves physically as one typically would see, maybe aligning with their age, their uh, culture, maybe in terms of even like cleanliness. Are they fully disheveled? Are they put together? That kind of stuff. Using feminine pronouns instead of male pronouns, sassy for Taki. Yeah, right. When Taki is speaking, maybe with that DID state of Mitsuha using the she, her pronouns. Yeah. Anyone else? Oh, Wad also says, Wright and others comment on the differences in their behaviors. Oh, that's true. That could be mentioned in the behavior, right? Like my friends are saying I'm not acting like I typically do, so that's worrying me. Generally speaking, their appearance conflicts with their behavior once they switch. Yeah, absolutely. So kind of aligning with that previous comment. Uh, this would have to be informed by the friends though as well. So that could be something they bring up in the initial consult, but wouldn't be something the psychiatrist might directly perceive, right? They always have a different body language, which is according to whether they are Mitsuha or Taki. Yeah, absolutely. Same thing might have to be informed by someone else, but brought to the initial consult, but absolutely. Awesome. So we touched a lot on appearance behavior. How about speech? I know Sassy mentioned something. Any guesses? So speech, oh, okay. Sorry, I buffered for a second. We switched slides. So different dialects, speech, yeah, that could definitely be part of it. Speech can also just broadly be determined by one's ability to communicate, right? If there are jumping around or physical movements, maybe repetitions and such of specific words or vowels and things like that. Quick speech, slow speech, stuff like that. So specifically for Mitsuha and Taki, their speech is both coherent and fluent, although there are some distortions in judgment and understanding of what's going on. They are presenting themselves as one typically would in their society. So I'm gonna look at the emotion and mood and affect, right? So mood and affect can, sorry, mood and affect can be something that the psychiatrist would analyze in that initial consult, but emotion specifically with the mood is a quotation. So the psychiatrist would ask, like, how has your mood been? And then whatever the patient answers after that goes in quotes under the emotion and mood category of the MSE. So we can't exactly determine that, but we can make little guesses. In terms of perceptions, auditory and visual hallucinations, unless you're going the route of the alcohol-induced psychosis, there aren't exactly all these auditory or visual hallucinations that we can pinpoint. Same thing with suicidal and homicidal ideation. That was not presented to us at any point in the film, so we're not going to make any judgments on that being present as well. For insight and judgment, insight and judgment are quite poor, right? So if we're going with the DID diagnosis, obviously Taki and Mitsuha aren't actually switching bodies or having these out-of-body experiences 3 years apart. So the insight would present as very poor as well as judgment. And their cognition, just their general way of discussing and presenting themselves and their order of thoughts, though there is not much insight to that order of thoughts, the cognition and their processing of these thoughts are intact. All right, does anyone have any questions about that?
Wait, what do you mean by cognition exactly?
Yeah, cognition is just kind of, I kind of like to look at it with speech as well, how someone processes what they're experiencing and orders it in their discussion. And so although the judgment of what's going on is impaired, right? So they're not actually switching bodies, their cognition and their way of thinking isn't, how do I say this? They're still able to make thinking processes as one typically would, and make judgments, although those judgments aren't based in a true reality, aren't based in with proper insight. Did that kind of make sense? It's basically like if someone were presenting and it might align with their speech is really disorganized and they don't know what's going on. Their cognition, they aren't able to make one steady stream of thoughts, and we can't see those processes in work as one typically would. Here, when Vanshika asked, just to clarify, they both. Oh, sorry, that's a different question. Does that kind of help you make sense? So someone with dementia, right, would present with an impaired cognition. So not only are they confused and they have poor judgment, but their thoughts are not aligned in one order. They're kind of dabbling here, not understanding what's going on here, and it's kind of all in one confused blur. Does that help at least a little bit? Yeah? Okay, awesome. Vanshika asked, so just to clarify, they're both having out-of-body experiences, excuse me, while Mitsuha's are 3 years ahead and Taki's are in the past. Are you talking about in terms of the DID aspect or like just storyline? Because storyline, yeah, so Mitsuha is 3 years in the past and Taki's 3 years ahead of Mitsuha in the storyline. So when they're jumping back and forth between bodies, they're actually also kind of time hopping in the plot line. Obviously, if this were a real case, the time aspect is a bit warped, right? So we're not going to have a presentation like at the same time with this time hopping. So yeah, it totally could be like Mitsuha is 3 years in the past, Naki's 3 years in the future, whatever. But they truly believe that they're going between bodies 3 years apart from the true time, which would be another aspect of poor insight and judgment. All right. Yeah, of course. Okay, cool. So we can move on to treatment. All right, so first for dissociative amnesia, I'm going to go through all three major diagnoses that we discussed, right? So dissociative amnesia, depersonalization and derealization disorder, and DID as well. So first for dissociative amnesia, typically the therapies that are used are either cognitive behavioral therapy or eye movement sorry, or EMDR therapy. So that's eye movement desensitization and reprocessing therapy. So this is actually a therapy that is quite widely used with PTSD uh, therapy and discussion of PTSD, but since its basis is in addressing traumas, it has also seen to be helpful with dissociative amnesia, as this could address the patient's traumas that are at the root of these dissociative experiences and amnesia. And then on top of that, medications tend to be a broad range of SSRIs that are used for treatment. On top of this, if we migrate to depersonalization and derealization disorders, the typical therapies used are once again CBT, and more broadly saying psychodynamic approaches. Not one specific therapy is used more than others, but kind of just that general approach. Once again, that would be in relation to addressing traumas subconsciously, analyzing why the subconscious is allowing the current events to unfold. And in terms of medication, also SSRIs are used for this disorder. Specifically, fluoxetine and sertraline are more commonly used, as well as the benzoclonazepam. Clonazepam, sorry. All right, and we can move forward. And finally, for DID, we once again have that CBT and psychodynamic approach, as well as dissociation-focused therapy and internal family systems. So I actually, prior to kind of unearthing this presentation, wasn't totally sure what internal family systems refer to, right? So if anyone else has the same confusion as me, internal family systems, it kind of identifies and addresses the multiple subpersonalities or like families within each person's mental system. So that's directly involved with DID and kind of getting at the root of addressing those various personalities or groups of personalities, however you want to group that. And then in terms of medication, we have once again SSRIs, fluoxetine and sertraline. And then although that's cut off at the bottom, the antipsychotic that we are referring to is risperidone. All right. Does anyone have any questions about anything that we discussed? Any other theories? You can totally add to the themes in the beginning from Nate as well.
I was just wondering, well, I don't know if you're going to get to this, but which one do you think that they have? Or like, or I guess which dissociative disorder, or just like a disorder in general? Because it seems, or at least like during a portion of their life, it really seems a lot like DID. But when I searched it up, the symptoms only really last, or those symptoms only really lasted for like about a month or so ish, or at least where they like very clearly like seem like they're switching bodies. So I just wasn't sure if like, because I thought that DID was supposed to be kind of like a, well, I mean, I think it can be treated, but like more of a lifelong thing.
Yeah, no, that's true. Once again, like when we talk about the anime didactics, this is similar to movies as well. It can't always be totally encompassing, so you're definitely bringing up a good point, right? So DID does tend to first of all be rooted in a trauma, which would allow the individual to kind of use that separate identity to branch off mentally from the trauma to not be affected, right? So it's kind of like a, I don't want to say coping mechanism, but it helps one cope by having that identity present for the trauma. Uh, and so that's why you see when people experience multiple very extreme traumas and they're predisposed to having DID, that they have those multiple personalities, right? So we aren't necessarily, unless I'm missing something, I've only seen the movie once or twice, but we don't necessarily see a certain trauma at work that would initiate this DID diagnosis. And we definitely, certainly, as you mentioned, don't see it persevere in the future, right? So yeah, we definitely have a bit of a lack in our diagnosis for sure. But if we're looking at the course of the movie, and we take out the end bit, It does seem to match the DID diagnosis specifically. I don't think I'd characterize it as dissociative amnesia or depersonalization, derealization separately, because those are all encompassed in DID. And since there are small aspects of all the diagnoses present, I would tend to lean towards DID. But I also, once again, like the alcohol-induced psychosis route. Um, yeah, I mean, those were the main ones that I thought were generally portrayed. It's definitely not like a totally true and encompassing diagnosis, but it kind of helps with the teaching points of what DID might present like. And of course, that time difference is very confusing. So it's also hard to pinpoint a diagnosis too specific with that in play as well.
I was also wondering if you thought that, or at least, well, or at least we see it's like Mitsuha, but like, I don't know, with Taki's personality, I don't know. But I'm just gonna pretend that this is like, if it is like DID, I'm just gonna pretend that this is just Mitsuha.
Mhm.
Um, like at the end when she's like convinced all her friends and like is telling everyone to evacuate because the comet's gonna hit, but like realistically, like she doesn't actually have any way of knowing this. Would you say that that's like a delusion or
Yeah, that could definitely be delusion. If it depends on how she's presenting, right? So if she comes to the psychiatrist and is like, yeah, I spoke with this boy 3 years in the future. Like I saw him right in front of me, and he told me that I'm gonna die and all of us are gonna die. 500 of us are gonna die if we don't address this comment in terms of an evacuation all throughout the village. Like we're all going to die. So not only is that a delusion presenting, but there are certainly hallucinations presenting. We'd have to see how long she's been hallucinating Taki, because that could lead to either brief psychotic schizophreniform or schizophrenia diagnoses. So yeah, there certainly could be that aspect of delusion. If the delusion is separate, then delusional disorder, maybe grandiose type, could be in play for sure. Yeah. Great. Let me, did that help, Adeline? Okay, perfect. Let me give it a check. Can you talk a bit more about EMDR therapy? I haven't heard it in so long. Yeah. So, it's not a very super widely used therapy, which is why I was in the same boat. Like I hadn't heard much about it aside from regarding PTSD traumas. So EMDR therapy, once again, eye movement desensitization and reprocessing therapy. So it kind of helps the brain like unfreeze traumatic memories. So sometimes with PTSD, maybe there are aspects of the trauma that aren't fully resurfacing, but one is experiencing like the anxiety symptoms that come with it, or the anxiety symptoms that come with any direct experience with the place where the trauma occurred or the people or discussion of it, whatever. So it first helps unfreeze the trauma so that you can kind of deal with the trauma. In terms of the mechanics, there are a lot of images that come into play when you look up like EMDR. I'm not totally sure how the physical movements of that work, uh, but it's just generally a way to reprocess trauma using some sort of like eye mechanics. I don't totally know a lot about it myself, aside from the general aspect of what it tries to provide to the patient. So if you have any questions on more mechanical, like how it would work in therapy in person, I definitely recommend asking Dr. T. But just so you guys know, that's why it would be used, and that would be how it would address the trauma, kind of like unfreezing, allowing to reprocess. At least that's how it's been presented to me in classes and such. Yeah. So I hope that helped. Once again, definitely more of a PTSD thing, but people have used it with dissociative amnesia. All right. So does anyone have any other questions? If not, you guys have a nice 18-minute break before Shivani comes on. So yeah. Alrighty. Well, always feel free to chat message me and such. I do want to, I don't think I'll be talking after Shivani, so just as like a general overview once more, real quick. I was reading through the chat this morning and saw a lot of confusion about like Friday, like TA session and such. I think the TA session thing must have been a typo on the master doc.